what we need to know about SSI, SSDI, Medi-Cal, and Medicare. So our presenter, this evening presenter, is Ellen Cookman. We say welcome. Thank you for being here.
Cool. Thank you so much. Okay, I'm going to share my screen. There we go. Okay. Yeah, so first of all, just to let you know, this is being recorded, so this will be available. So please don't feel like you have to take a lot of notes. We're going to cover a lot of topics. Just kind of let it wash over you. And I like thinking of this as a different language, you know. I hablo un poquito español, pero no muy bien. So there's many different concepts we'll cover, and it's like a new language. And so, you know, each time I think people retain a little bit more. So first, a little bit about myself. So I'm an estate planning attorney, and I specialize in special needs planning. I run a law firm in Palo Alto called Cookman Law, and there's 13 of us now, 3 attorneys and support staff. I got my JD, my law degree in Berkeley, and an LLM at Golden Gate University, but I think the most important thing is that my 12-year-old son has high-functioning autism. So I started in this field before his diagnosis, but it was interesting going from really an advocate in the community to a parent of a child with special needs. And he's wonderful, and we love him so much. But, you know, each kid has their own strengths and weaknesses. So, so today we're talking about, first we're going to look at an overview of public benefits, then we'll talk about the income stream component, and then we'll talk about the medical benefits, and then we're going to talk about some changes in the law that took place this year, so it's actually very exciting. Okay, so just to let you know, you guys know disability, there's many different types of disabilities. You may not know that 16% of the people on Medicare are actually disabled and under age 65. So, you know, this affects many people in many different ways. 1 out of 10 people live with a severe disability, and you're on the call. So you most likely have a family member who has been affected by a disability, and we want to get great information to you. So when you're talking about a disability for public benefits programs, what does that really mean? Okay, basically, we're not just looking at, you know, what diagnosis does your child have? Down syndrome, cerebral palsy, you know, genetic disorder. It's more that because of your disability, you can't work and support yourself. And so that's really, you know, what they're looking at. Okay. It's not just, you know, like Stephen Hawkins, very famous physicist, was profoundly physically disabled, but he could still work. So, you know, if he had lived in the US, he wouldn't be receiving public benefits. So I think it's important to see that distinction. Okay, so let's talk about those public benefits. So I really see them as there's 3 different categories. There's public benefits that you need to be, they're called needs-based because you need them because you're poor, because your resources are low, okay? And that would include SSI, Medi-Cal, and under the umbrella of Medi-Cal is IHSS. Okay, then we have entitlement-based programs. That means that somebody paid into the system. You know, they worked for a while and then they became disabled, or they worked for a while and then they retired, and maybe their child was under age 22 and their child also is receiving public benefits. And then also Medicare, you know, that's something you work for a while and then you turn 65, or you get SSDI and you also get Medicare. And then there's a couple of other benefits programs that I'm not going to talk about tonight. There's Section 8 housing, and then there's veterans benefits. I do have a YouTube channel, and it's pretty popular. It has over 7,000 subscribers, so don't go there now, but you know, after this, please go there. I do have what I think is a very good video on Section 8 housing. Oh dear, I had not changed the slide. I'm looking at these slides in front of me, but I need to also change the slide over here. So I'm just going to rely on this slide. And if I'm looking over here, that's what happens. So I apologize for that. So we have the needs-based public benefits. I see some thumbs up. I'm so sorry about that. So Supplemental Security Income, SSI, Medi-Cal, and IHSS. So those are all needs-based. Those are, you need to be poor or have low income. Entitlement-based, SSDI, child disability benefits, and Medicare. And then the other programs that I'm not going to be talking about tonight are Section 8 and veterans benefits. Okay, so here's my big old chart on where do all these fit? Okay, so the way I like to think of it is if you're working, you get two main things. You get a salary, which is your income stream, and you get health insurance. Now, it's my hope that someday the US will figure out a way to not connect working with health insurance. But we're not there yet. And so, you know, if somebody's not able to work and support themselves, then we need to look at how will they get health insurance. All right. So now the top row, those are the needs-based programs. Those are the ones where you need them because you have low resources or low income. So the top left is Supplemental Security Income, or SSI. And by the way, I see that there's some questions coming up in the chat. What I'll do is I'll pause after this slide and next slide, and then I'll look to see, you know, be able to answer as we go. Okay, so SSI, Supplemental Security Income, that's basically an income stream where you can get almost $1,200 a month. Federally, it's about $940 a month, but they supplement it. And if you get even $1 of SSI, you automatically qualify for Medi-Cal, which is California's version of the federal Medicaid system. Now, one of the big changes that has happened in Medi-Cal that we're very excited about is that they have eliminated in California the resource limit. You don't have to have under $2,000 of assets to qualify for Medi-Cal. You still need to have under $2,000 of countable assets to qualify for SSI. All right. SSI is federally based, and so California can't fiddle with that. But California did manage to eliminate the resource limit for Medi-Cal. However, there still is an income limit. And if you go over the income limit, you have to pay a share of cost. Okay. So those are the needs-based ones, the top row. And then the bottom row are the entitlement-based programs. So on the bottom left, you have SSDI, Social Security Disability Insurance. That's if you paid into the system and then you became disabled, then any of us could get SSDI if we paid in and worked enough, okay? And then if we paid in and we retire, or I guess if we become disabled, and then our child is under age 22 when they became disabled, the child can receive half of what the parent is receiving, and that's called child disability benefits. And keep in mind, Social Security Administration often does not tell you that your child will qualify for that, and you have to ask for it. And the really nice thing about CDB benefits is there's no resource limit. You don't have to have under $2,000 of countable assets because it's entitlement. You paid into the system and now you get this, okay? Now, the really good thing about SSDI and CDB, or actually it just gets better, is after 2 years and a waiting period of 5 months, you qualify for Medicare, all right? Now, there's some people who get both. They get Medi, and I think I'm going to talk about that in the screen. Okay, now this is a timeline where I show when a child might receive each of these benefits. Okay, so stick with me here. All right, so you'll see at the top, you know, we have Medi-Cal, then SSI, and this is on the left-hand side, then SSDI and CDB, and then Medicare, and then the regional center. And I haven't mentioned the regional center yet, but I'm sure many of you, you know, your kids are consumers, they're clients of the regional center. Upon birth, your child can be eligible for the regional center if they have a disability, and they can be eligible for Medi-Cal, through a waiver program. So any child in California can qualify. It's basically a grant through the state for Medi-Cal. Okay, so then time goes by, then we have the child turns 18, and all of a sudden their parents' money is not attributable to them. They become poor, okay? And now they can start receiving SSI benefits, all right? So they can start when they turn 18, as long as their assets are under $2,000, they can start getting that income stream of a maximum of about $1,200 a month, and they switch to a different type of Medi-Cal. Okay, so now time goes on, and the parent retires. I don't know when the parent retires, but I said the child's probably in their 40s or something when the parent retires, okay? Then the child can start receiving CDB benefits under the parent's work record, okay? And then after 2 years, the child can start getting Medicare. Now, at this point, when the parent retires and the child receives CDB, if CDB is greater than the SSI check, greater than the 1,200, then SSI goes away. All right, because SSI is really to supplement any income you're already receiving. Okay, then when the parent dies, the child receives 3/4 of the parent's Social Security check. All right, and so that's kind of how things go. So at some points, your child might be receiving one type of benefit or two, and then it might switch as time goes by. Okay, so I'm gonna take this moment to check. Oh my goodness, 14. No, that's chats. Oh, okay. So there's sorry. Okay, let's see. Is that the Q&A? Q&A, 4 questions. Is there a resource limit for SSDI? No resource limit for SSDI. Yay. So for CDB, is the limit half of 1,550? So for example, if the parent is receiving $1,550 of Social Security for themselves, then yes, the child would get half of that, would get $725 a month at the same time that the parent is getting their full amount of $1,550. So they receive it at the same time. Okay. And then the next question, so am I getting this right? My son who has significant disability can get 1/2 of what I paid into for SSDI, even if I have no disability and it is my only son. So once you start receiving your retirement, once you retire, that's when your son with a significant disability, as long as he became disabled before age 22, he can get half of what you're receiving, and that's called child disability benefits. Does the child's share of SSDI get deducted from the parent's share? No, that's one of the great things. No. Is this taxable? I don't think so, but I would have to double check. If one parent dies, does the CDB transfer to the other parent's Social Security? So basically you look to see which parent has the higher amount, and it's based off of the higher amount. You don't get both. So if you have, mom who's getting $3,000 a month and dad's getting $2,500 a month, then the CDB benefits would be based off of mom's. So it'd be $1,500 a month for moms. And then when mom dies, then it's, oh boy, I chose some bad numbers to do math on, whatever that is, 2,250. So that's kind of how you do the calculation. So no, the child does not get to collect both parents' CDB. So my son is receiving institutional deeming Medi-Cal. Would he qualify for SSI due to status now at age 13? Most likely not, because usually children start getting SSI when they turn 18, because the parents' money is attributable to them. And if the parents have more than $2,000 in countable assets, that would disqualify the child. If I go back to work, will my child lose their Medi-Cal? No, I don't think your work is connected. Oh boy, these questions keep coming. I think we need to move on a little bit and then we can circle back. How about that? Does that sound okay? Because I do want to, get through my slides, but these are all very, very good questions. Okay, so let's go on. Okay, so I did mention that a child can be Medi-Medi. They can receive Medi-Cal and Medicare. And a child can also receive SSDI and SSI. So one example of this, let's say the child gets $500 of SSDI, The SSI supplements whatever income the child's already receiving up to $1,183. So that means that then they get SSI of $683. Okay, so, and if let's say they had $800 of SSDI, then they'd get, 483. So whatever, or sorry, 383. My math isn't great tonight. So whatever you can add on to the top, that could be the SSI. Okay, so here are some, we love using our acronyms and it'll drive you crazy because here's the problem. SSI and SSDI, they sound the same, don't they? They're just separated by one letter. Same thing as Medi-Cal and Medicare, they both start with Medi, it'll drive you nuts. Child disability benefits, just to let you know, it used to be called Disabled Adult Child Benefits. They changed the name, so you may have heard of it that way. And then the other thing to know about is the POMS. Sometimes we refer to the POMS, which is basically, it's an instruction manual that Social Security workers use to calculate numbers and to look up eligibility questions. Okay, so let's dive into cash benefits. So and hopefully these questions will also address, because we're gonna focus in a little bit more. Hopefully these will address some of the questions that have come up in the Q&A. All right, so to qualify for SSI, right, we talked about, until age 18, the parent's income and resource is deemed to the kids. It's so funny that age 18 is the magic number, because if 18-year-olds, a lot of times they are not quite adulting yet, right? But they're still, whether they have disabilities or neurotypical, but they're still considered adults. So that's the time all of a sudden they're an adult, okay? And that's the amount that they can receive, up to $1,183. California adds like a $200 supplement. Thank you, California. And then you can qualify for Medi-Cal. No resource limit. That should not be on the SSI slide. That is a Medi-Cal thing. SSI does have a resource limit, so I apologize. I need to go back and change that. They need to be disabled, and which means that their disability will last at least 12 months, and it prevents them from working and engaging in substantial gainful employment, which is that term actually is 138% of the federal poverty level. Okay, so this year it's $1,550 a month. So if the child is not able to earn that much because of their disability, that's when they can qualify for SSI. Okay, so what counts as income for SSI? All right, they can, because dollar for dollar, well, hold on, let's talk about that. So for earned income, okay, if a disabled person is working part-time, then if they earn, basically if they earn $1, that reduces their SSI check by 50 cents. Okay, so it's a partial reduction, but they want to encourage people to work so they don't reduce it dollar for dollar. However, unearned income, like your SSDI payments, other things, if somebody else is paying for your food and shelter, that can count, or like dividends, if you own some stock, that would be unearned income. All of those reduce your SSI check dollar for dollar. Okay. If you have an ABLE account, that does not count as income, or payments made from an ABLE account is not income. And then bills paid by someone else for things that are not sheltered, that doesn't count as income either. All right, so let's compare that to SSDI. All right, so we were talking about this person that paid into the system, right? You need to work at least 20 credits in order to start getting SSDI. Now, SSDI does not have that passive or unearned income limit. You can be, receiving income from other places, but it does have an earned income limit. And those limits, those things they're pretty tricky. And I think my next slide goes into that a little bit, but again, I have a really good video called Working While Disabled, and I talk about the impact on SSDI and how much you can work and not, and they go through a big rigmarole. But I do think the next slide talks about that a little bit. Okay, if you qualify, then you know, they calculate how much you'll earn, and then after 24 months, so they make you wait for 5 months in order to get SSDI. And then once you start getting SSDI, then they make you wait 24 months to start getting Medicare. Okay. So who can qualify to receive SSDI? The person who is working themselves, you know, they paid in, or their spouse can qualify under the worker's record, or a widowed spouse, or a divorced spouse. So there's all different rules on what has to happen in order to. And then the child, okay, if a child's under age 18, or if they're unmarried and they became disabled before age 22. Now, there's horrible rules in public benefits that discourage marriage for disabled people, and I think it's totally wrong. But unfortunately, that's where we are today. Okay, so oh yeah, let's talk about child disability benefits, and then we'll look at some of the questions. Okay, CDB benefits. So this, again, the disability had to manifest before age 22. It doesn't matter the age of the child to start getting CDB benefits. So they could be 40 when the parent retired at 70, as long as they had been disabled before age 22. All right. And we already talked about them getting 50% of the parent's work record while the parent's retired but alive, and 75% after the parent has died. And there's no passive income or resource test for CDB benefits. So again, it's a really good one if you can get it. All right, so this is a very brief summary of that video that I mentioned when you're working and receiving SSDI or CDB benefits. And I feel like this does not do it justice. You really need to go into depth. But basically, first of all, you know, you need to be disabled. And then when you start working, you're under a trial work period for 9 months. Okay, and that could be within a 5-year period. And then after that 9 months, the trial work period ends, and then you have 36 months of extended period of eligibility. And as long as your earnings stay below that substantial gainful employment level of $1,550 a month, you can continue to be on this program. And then if it goes over the SGA, then you go into expedited reinstatement. So these are all steps. I think they see them as stepping stones to becoming more independent. But then there's always a safety net that, you know, if you're not able to work so much, you can always go back on SSDI. So that's the intent. So during this presentation, I really can't delve into all the little nuances, but suffice it to say they exist. Okay, so did I not go on? Oh no, I have not been going on to this. This is totally not working. Okay, you will get the video, and we'll also send you the slides so you can go through and look at the slides yourself. But those are the different ways. Okay. So before we go on to medical benefits, let's see what's in the Q&A, and maybe it's some people also telling me, hey, Ellen, move along your slides. Okay. Correct, there's no resource test for SSDI. Does the child get CDB benefits until they die? Yes, unless they're able to work and support themselves, like this slide. You know, if they're able to work and earn enough for long enough, then they stop receiving their CDB benefits. Does the child have to be a minimum age to receive CDB? No, there's no minimum age. It's just a minimum age of onset of disability. Okay, does the child have to qualify for SSI to receive CDB? No, the two programs are separate. The qualification process for CDB, it's the same looking to see if you're disabled, but it's a different income stream. So SSI is to supplement any income you're already getting. CDB is if somebody's worked and contributed to the program. Okay, is share of cost threshold for SSDI changing in 2025? We hope so, and I just recorded a video on this. The share of cost, hopefully, I actually have a slide on that later, so we will look at that. But the answer is yes, if California funds it. Can people who didn't get accepted into the regional center still qualify for SSDI? Yes, the regional center and Social Security Administration do their own separate analysis, I believe, of disability. So there could be somebody who's not part of the regional center and still gets SSDI. I don't know how common that is. A lot of Social Security applications are rejected. But then if you appeal, so 40% of the applications are rejected, but then if you appeal, 50% of the appeals are accepted. So the moral of the story is you should appeal. Okay. Okay, my son is turning age 18. Will there be any changes with his Medi-Cal? He'll need to switch over to there's like 4 or 5 different ways to qualify for Medi-Cal. So the waiver program for under 18, that ends, and then he can get Medi-Cal on a different program. Okay. Yep, I forgot to change the slides. You guys are right. But the slides will be available later. Okay, there's a long question. I can't go into that. Many of you told me to advance my slides. Thank you. Okay. If you receive SSI and you're working, but then you get laid off, can you still receive SSI, or do you have to apply for unemployment? I think the SSI is modified. So if you're working less, then you can get more SSI. And if you're working more, then you get less, or vice versa. Okay, so moving on, medical benefits. All right, so first let's talk about Medi-Cal. So Medi-Cal is California's version of the federal Medicaid program. California always likes to have these cutesy names, Medi-Cal, Cal-able, right? And so these are the different ways that you can apply for Medi-Cal, right? We were just talking about somebody who's, under 18 and then they turn 18. How are they going to still qualify for Medi-Cal? So there's the categorical eligibility. You're receiving SSI and you automatically qualify for Medi-Cal. There's the medically needy Medi-Cal, which is where you have too much income and then you have to pay a share of cost. Then there's the waiver program, that's the before age 18. And then there's expanded Medi-Cal, where they don't look at your assets, they just look at your income. So that's kind of basically low income Medi-Cal. So that's part of the Affordable Care Act. And so they look at, your income, is it less than the federal poverty level, or 138%. And it's based on your modified adjusted gross income. You don't have to be disabled for this. So any low income person could be receiving Medi-Cal, and there's no asset test for this one. But it only lasts until age 65. And I presume that's because Medicare starts at age 65. Okay. The waiver program, as I mentioned, these are grants. And basically that's how children qualify. And there's a few other grants where, certain groups of people receive Medi-Cal through these waivers. Okay, in-home support services, some of your kids might be receiving that, and some of you might receive an income from this, all right? So this is basically when you have a disabled child or individual who needs assistance with the activities of daily living. So they have to have been, they have to be eligible for Medi-Cal. So it's the same eligibility rules. They need to live at home, and usually there's a social worker who will do an assessment to see how many hours are granted. A lot of times they don't give you as many hours, and it doesn't pay a very high amount, but it's nice to get to be paid something, especially if you're a parent who's providing care for your disabled child. And this is really the only program that provides for in-home care. I was hoping there'd be another one under a new president, but unfortunately, that proposal probably won't go through. Okay, so we did mention that after 24 months plus the 5-month waiting period, if you're on SSDI or CDB benefits, then you qualify for Medicare. And that's really one of the main reasons why people really care about the CDB benefits, because Medicare covers a lot of things that Medi-Cal does not cover. So Medicare covers health insurance for those who are 65 and up, and then those with certain disabilities. A lot of doctors will accept Medicare that do not accept Medi-Cal, but it doesn't cover other things. It does not cover a long-term nursing home stay, for example, whereas Medi-Cal will. All right, so there's distinctions. So then there's also, you know, the Part A through Part D that you can get for Medicare coverage, and it covers different things. Okay. One thing that I found with Medi-Cal, if you have both, Medi-Cal does a really good job covering prescription drug costs. So if you have Medi-Cal, perhaps you don't need Part D Medicare, you know, but so you look to see, you know, what things are covered and what are not. I wish they made it easier to tell these things. So regional centers, many of your children most likely belong to a regional center. So this is for somebody, a child with a developmental disability. Regional centers are not available to people with mental health challenges or physical disabilities. It must be a developmental disability. It's basically, you know, they're, I should show the map. You know, there's like, I think 24 regional centers around the state. So in Santa Clara County, we have San Andreas Regional Center. And they look just to see what type of disability is it. There's no financial eligibility test for a regional center. And then once your child is deemed eligible, then, you know, there's a case manager who kind of helps to coordinate care. Now there's a self-determination program, which I've heard from several clients, they really like it because you get to choose what kind of care you want. And again, you know, most services and support, it's free regardless of age or income. So I don't think you really age out of regional center support. They may not have the support that you might need, but they also help to provide housing to those with developmental disabilities as they age, and as the parents may not be able to take care of them at home, or if the parents pass away. Okay, so I'm going to pause here before I get into the really exciting stuff. So you may want to take back your question because you know, it's the new changes that I think are super cool. Okay, question and answer. So let's see. If questions are not answered here, will they be answered some other way? I'm wondering, maybe Teresa and I can talk after this and we can figure out a way to submit other questions. I will also provide the email of our office, you know, so you can ask questions, but I'm not sure how many of them I will be able to answer personally. Okay, does expedited reinstatement happen regardless of how long they were beyond qualifying for wage earnings? I'd ask you to watch my video to see all the numbers, because I go through the numbers on that. Can we hold off on Medi-Cal since our child receives private health insurance under us until age 22? Yes. Yeah, you don't have to sign up for Medi-Cal initially. Some people choose to, some people choose not to. It can also be a backup payor. For IHSS, protective supervision for mental illness for an adopted child, do they count the adopted parents' income, I don't know. I'm not so familiar with the rules regarding adoption. What is considered retirement? Does it mean receiving Social Security and working, or does it mean 100? That's a very good question. Or is it 100% Social Security? I don't know. There are people who specialize in, how to maximize the amount that you can get and your child can get, and they kind of calculate it out to figure out when should you retire. And I recommend that you go to somebody like that, because it's worth its weight in gold, okay, or in money in this case. Any tips on how to get better support from a regional center? No, you're dealing with a government entity that's overworked and underpaid, and it's difficult. Yeah, so I don't really have a magic wand, unfortunately. Did we say that Medi-Cal covers extended hospital stay, but Medicare does not? I'm actually talking about a long-term nursing home stay. Medi-Cal will pay for that. Medicare pays for the first 100 days of being in a rehab facility, but that's as long as you're getting better, or perhaps you're plateauing. If you're starting to get worse, or even sometimes plateauing, then Medicare might bump you off even before that 100-day period has ended. How do you apply for CDB? You contact the Social Security Administration, and talk to them and say, hey, we think we qualify for CDB. Somebody keeps asking about monthly AAP payment. I'm not sure what an AAP payment is. Can somebody, maybe the person, type that out so I understand? There's also a question that keeps coming up. Is there a way to type or document the actual answers here, or do we lift them? Yeah, I'm not typing out the answers. I can't even sort out how to, coordinate the slides with what I'm saying. So typing it will be a little bit distracting. Can you provide the names of one of the experts? Yeah, feel free to reach out to my office, and I can provide some names of people who do specialize in, when you should think about retiring. Oh, adoption assistance program. Yeah, I don't have an answer to that. I don't know if that again, that's, the rules for adoption. I'm just not super familiar with those. Okay, so let's talk about the changes. Okay, recent changes. Here we go. Here's an exciting one. So if you are, what is in-kind support and maintenance? You might already know this, and I do discuss this on my SSI 101 video, okay? But basically, if you're getting your full amount of SSI, $1,183 a month, and then somebody's helping you with, it used to be 3 categories: food, clothing, or shelter. SSI, Social Security Administration, thinks that $1,183 a month should cover your food, clothing, and shelter for the entire month, which is laughable. It's like, really? But then in 2005, they eliminated, yes, somebody's laughing in their little icon. I agree. Like, how do you survive on that? Even if you're not in California, there's no way, right? So they eliminated the clothing aspect in 2005, and they just removed the food component. So now they're not looking to see, did somebody else pay for food in order to impose that ISM deduction, which is basically deducting about $350 or $400 from your SSI check because somebody else is helping to pay for your food. It's ridiculous, and I'm so glad that it's gone. I think as ridiculous as the deduction was, it was even more ridiculous because people had to put in, like, what are they eating and who's paying for it? I mean, what a pain. So a lot of these changes, it was to eliminate paperwork and make things more user-friendly. Commissioner Martin O'Malley, is the champion of a lot of these changes. And so we should all pause and say, thank you, Martin O'Malley, because he's the one who got these things passed. Yes. Okay, the other amazing thing about the ISM deduction is that it used to be that you had to pay the fair market rent of wherever you're staying personally, if you're receiving SSI, in order to not get the ISM deduction. So, if you're in, my office is in East Palo Alto, right? If you or I live in East Palo Alto, my office is in Palo Alto. If you're renting a room in Palo Alto, that could be like $1,000 a month. So you'd be paying your entire SSI check basically towards rent. Ridiculous. Okay, so what happened was there's a few court cases out there around the US where people sued about this and some regulations. And basically they decided at SSI, hey, we're just gonna make it the same around the country. We're gonna say now all you have to pay for rent is $334 a month. That's it. Okay, not 1,000, not 800. We won't make you get comps and figure out what is the rent in this area. 300, if the beneficiary of SSI is paying their own rent for $334 a month, then they shouldn't get that ISM deduction. Now, there's other things that can cause the ISM deduction, like, you know, paying for your utilities and your gas and different things associated with your home. But the rent one is usually the biggest one. Okay, so that at least has been shrunk a bit, which we're really excited about. Okay, another change was that the definition of public assistance household has been modified. This is part of the eligibility process, that you have to be part of a public assistance household. So they changed it. It used to be that everybody in the household has to be receiving some form of public assistance. Now it's just you and one other person needs to be receiving some form of public assistance, and food stamps, SNAP assistance counts. So that makes it easier for people to qualify. The last change for SSI is and unfortunately, I don't know if you know anybody where this has happened, but SSI has been making a lot of claims for overpayments recently. I have one client who they said, the special needs trust wasn't drafted properly, first party special needs trust, and therefore we're going to withhold 100% of your SSI payment until this gets sorted out for 2 years. All right, she's relying on this payment. I mean, it was ridiculous. So, you know, we appealed this and everything, but the new rule is they can only withhold 10% of your SSI check, which still isn't great, but it's a lot better than 100%. All right, so you still have a lot to live on. And this is even if SSA has made a mistake and there hasn't been any overpayment. Okay, so those are the big SSI updates. All right, the big Medi-Cal update, as I had mentioned, is we used to have an asset limit for Medi-Cal of $2,000 per individual and just $3,000 for a couple. It was crazy. You could have some exempt assets, but then all of these countable assets in the middle column, those would count towards that $2,000. So you basically had to be poor to get health insurance, which was ridiculous. All right. Now there's no asset limit. Yay! Oh, we're still having celebrations. Okay. And there are certain things that, yes, please celebrate with me. Yes. So you can keep a lot of your assets. However, you need to watch out for the income. All right, because as I mentioned before, you can if you have income of over $1,732 a month. Oh wait, hold on. I thought it was $1,550. I'll have to go back and double check that number. So many numbers in this. Then if you go over the limit, then you have to start paying share of cost. So you really do need to monitor how much income is being accrued if you have, an income-bearing account. Okay, so somebody had asked about share of cost reform. This reform was done in 2022 to 2023, that legislative year. But then unfortunately, they haven't funded it yet. So it's supposed to become effective January of 2025, just around the corner, but they haven't put the money in to be able to effectuate this. So what does that mean? We're still waiting to see when it will become effective. But when it's effective, we are very excited. So let me tell you what you should be excited about that's coming up. All right. So here's how share of cost used to work. All right, they said, okay, you can make up to, so it is 1,732. Okay. You can you can have up to $732 of income per month and get your Medi-Cal and not have to pay any deductible, any share of cost of premium. So share of cost is like the deductible, okay? But if you go even $1 above that limit, then all of a sudden there's this horrible draconian share of cost that's implemented, all right? And basically they say, well, you can keep the first $600 of your income, but anything over that is paid towards your share of cost. So you go from paying $0 to like $1,100 a month. All right, ridiculous. This is crazy. Okay, so what they did, so this is the change that makes all the sense in the world to me. All right, they said, well, how about this? We'll say, and that was the maintenance need income level, which was $600. All right, that hadn't changed since the late 1980s. So that tells you like how old this is. You know, think about what you could buy in the late 1980s, right? Well, they have increased that number to $1,732 a month. So basically what that means is if you earn $1 over $1,732 a month, you'll be paying $1 share of cost. So anything over that limit, that's what you're paying towards the share of cost. So it's still not perfect, but it's so much better than having to add that extra $1,100 and basically wipe out all of your income because you went just a little bit over your income level. All right. Now there are some deductions that you can take, and I go into that in my first share of cost video on YouTube. So I talk about there's a few deductions, like if you get dental insurance or a different type of insurance, then that can reduce your countable income. But this is even better. All right. Okay, so I'm going to pause there and answer some more questions because I have some suggested next steps, but let's take questions first. Okay, Q&A. All right, for regional center help, move to self-determination and get an independent facilitator to help you. Thank you, that's a great suggestion. Okay. Recommendations for accountants who understand government benefits. I wish. If anybody has a recommendation, please let me know. I have been asking around. I cannot find a single person who specializes in public benefits or special needs trusts or anything. It's so frustrating. Okay, this keeps kind of scrolling. Uh-oh, I think I lost my place. Where is that one? What if someone is helping to pay for food and shelter, but they can't continue? Does it still count against their total cash payment? I'm not quite sure what that question means. So if you could retype it in Q&A, that would be great. Okay, what if there's an underpayment for SSI? Can you get the difference back paid retroactively? Yes. Yeah, if there's an underpayment, then they'll pay you it all at lump sum. And then you probably have to spend it down that month because you don't want to go over the next month, right? I turned down CalFresh because even though he's renting a room and considered a single household, he's still living under our roof and would not be eligible until 22. I believe that's correct. I believe so. Is IHSS taxable? And if not, why? I would have to double check. I'm not quite sure if it's taxable. If a child doesn't get approved for SSI, will they also not get approved for CDB? That's right. So the disability analysis for SSI is the same one as for SSDI, and CDB benefits is under the SSDI one. So, okay, so now I'm going to scroll up because I think there's some that I missed. If your child gets CDB and it's more than SSI, would they then not qualify for Medi-Cal? Ooh, good question. So they wouldn't qualify for the Medi-Cal from the qualifying Medi-Cal where you get SSI and then you automatically qualify for Medi-Cal. They'd have to apply under a different umbrella. Does Medi-Cal cover private therapies that are not insurance covered, like speech therapy, occupational therapy? I don't believe so. You can double check. I have not seen that happen. Okay, with the new rules, I want to confirm that a first-party special needs trust can purchase restaurant gift cards, and this would not impact SSI for the beneficiary. So typically the rule is, if you're giving a beneficiary cash, that counts as income, and you're not supposed to do that. If you give them a gift card, the question is, can you convert that gift card into cash? If you cannot convert the gift card into cash, typically it does not count as income. And so the benefits are still protected and you can do that. So that's kind of the delineating factor. Based on this info provided, my daughter qualifies for SSI, but how do I check this? You apply for SSI and you see what they say. I've heard that it takes years to apply for SSDI. Is that true? It can take a while. Be prepared. Be prepared to wait. Okay. Will the $334 be inflation adjusted every year? I'm not sure. I would need to check on that. Okay. I'm covered by my employer's medical insurance. Currently, my son is on my employer's insurance. Is Medi-Cal a supplemental insurance on top of my dependent insurance, or can I stop my employer's insurance and rely on Medi-Cal? So I'm assuming you're saying stop the insurance for your son, and so your son can only receive Medi-Cal. I can't see why not. Like if it's too expensive to cover your son, you'd probably want to run some numbers and see, but I mean, I guess it's physically possible to. A lot of people don't want to because typically private insurance is accepted by a lot more providers than Medi-Cal is. Okay, I think a few more came up. Daughter is 19 and has Medi-Cal through the adoption program. This ends when she turns 21. What do I need to do that she continues to get Medi-Cal? So you talk to Department of Healthcare Services in your area and find out which Medi-Cal program she might qualify for when she turns 21. Does the benefited recipient get audited by SSI? So SSI sends around something called a redetermination form, and so does Medi-Cal, and they ask you questions. It's typically every 1 or 2 years, and they say, are you the beneficiary of a trust? Are you receiving gifts from anybody else? And they kind of ask you these things. They might ask for copies of your bank statements as well. So they have you fill out a form, and then they might come back and ask more questions. So basically it's kind of your self-reporting based on the form that they send you. Okay, I missed the part when you mentioned the scenario where somebody can have SSI and SSDI. So that's if somebody has some SSDI, but not at least $1,200 worth. So let's say they get $300 of SSDI, then they can supplement that income with SSI to top it off at $1,183. Okay, so I'm now going to just go back to my slides. So suggested next steps. So a lot of times you can hear all of this information, be completely bombarded, and I warned you about that at the beginning, right? But you guys are asking really amazing questions, and it shows that you've experienced this and you are really zoned in, which is awesome. But I do suggest, that you, one thing that you do, and, in our next session, we're going to talk about estate planning, but you can look over your estate plan to see if it matches the public benefits that your child is receiving. And if you're not sure, or if you need to update things, that's what we do. We don't do public benefits planning. We help when people already have their public benefits, or they might work with a different attorney to appeal a denial. And then they come in and we help with the estate planning and the special needs planning. We also ask you to share this information with others who could benefit. So this is a sketch. We're actually located all over the US, but we come together for team retreats. It's really fun. So this is our team. And with our planning, we do charge a flat fee. And it really, the fee really, I can't really quote a fee because it really depends on how complex the situation is and what type of planning we're looking at and what problems we need to solve, basically. We encourage you, as I mentioned, I have a YouTube channel, and I think it's a good way to really learn this material. So feel free to like and subscribe. And if you're on social media, Facebook and LinkedIn, we post on those regularly. And then here is a QR code. So we do send out a monthly newsletter with updates and relevant information for the disability community. So feel free to, take out your phone and scan that QR code, and then it'll send it bring up a little message, I think, to ask to be connected to our newsletter, and also to receive the slides for this presentation. And if somebody comes in from this presentation and does need estate planning, we will make a $300 donation to Parents Helping Parents as a thank you. Okay, a couple last questions, and then I'm going to turn it back over to Teresa. Okay, do you have a sharing worksheet anywhere for SSI? What can be counted and shouldn't? You should be able to look online and find that. The Social Security Administration has some pretty good materials on that. Is money used from an ABLE account reportable? It's not reportable as income. I think I'm going to have a presentation. So this is a 4-part series, and I will have a presentation on special needs trusts and ABLE accounts. So come to the ABLE account one to find out all about them. Who does public benefits planning? Boy, there's different people around. I don't want to shout out anybody here because it really depends on what's needed, what type of benefit. But if you have a specific thing and you reach out to our office, we can give you some names. Okay, so then somebody has a suggestion for a nonprofit that gives guidance on healthcare coverage options. Do we have a complimentary initial consultation? We do not. What we do offer is, you call in and you can talk with someone from our intake team and you can describe your situation. We can let you know if, this is something we can handle, or we can refer you to somebody else who does. Can you click back to the social media platforms? You got it. There we go. YouTube, Facebook, and LinkedIn. Where can I get this recording? You'll have to ask Teresa. It's going to be housed with her. Okay, and then FYI, Cindy gives an FYI to whoever asked this question. A disabled child can live in a parent's house, not on benefits, and receive CalFresh. Thank you, Cindy. All right, so I'm going to stop my share. And thank you so much for attending. I know this has been a difficult day for many of us, but thank you for coming, and we can, add a bit of happiness and information to your lives.